When to expect back pain from scoliosis. We know scoliosis is a spinal condition, but the effects of the scoliosis can be felt throughout the entire body. And we know scoliosis induces a lot of uneven forces, not just to the spine, but to the surrounding muscles, nerves, and tissues, which can affect the entire body. Now, we know scoliosis is an unnatural sideways curvature. And the sideways curvature or spinal curvature also has a twist, which makes it a three-dimensional problem. Scoliosis is progressive, meaning it's its very nature to worsen over time. And as scoliosis progresses, the size of the scoliosis curvature increases and the amount of rotation will increase with it. And as these two things increase, the spine becomes more rigid and the condition effects tend to become more noticeable and more severe. The main effect with scoliosis can also differ depending on scoliosis in children versus scoliosis in adult patients. So the main effect of scoliosis in children is postural deviations, such as uneven shoulders and hips. Now, this postural effect is by far the most common thing that we tend to notice, and it's the number one reason why scoliosis in kids is diagnosed. In fact, if we see an asymmetrical posture in a child, there's no normal reason for kids to have uneven shoulders or an uneven rib cage or uneven waist. If we see any of that, it's definitely an indication to have a spinal check to see if there's any type of scoliosis occurring. In children, we also see some common effects that may affect balance, coordination, and gait. And this is happening as a direct result as the spine becomes more and more misaligned or more scoliotic. It tends to affect these things because it affects something that we call proprioception, where your body is in space and how your body interprets that. So as it interprets this differently, it can affect balance, coordination, and gait. Now, in adults, we definitely see this continued postural change. But the number one thing that brings on a diagnosis in the adult patient isn't posture. And even though the posture could be significant, it's normally leaning further to one side, the left or to the right. But the main symptom that we tend to see associated with diagnosis is pain. And this is typically lower back pain that radiates into the extremities due to something called nerve compression. Now, the reason why pain is the main symptom in adults versus children is because in the adult patient, scoliosis becomes a compressive condition as a result of gravity over time. In children, even though they have a chance of progressing rapidly during this growth phase, these kids are elongating and they're growing around the scoliosis, so therefore they're adapting to the curvature as it's developing, and they're growing around it, and this doesn't lead to any type of compressive nature to any kind of tissues, muscles, and nerves. So therefore, they're not causing any kind of pain or discomfort. In fact, the fact they don't have pain during childhood progression is one of the reasons why a lot of parents discount the serious nature of scoliosis, because they say my child's experienced no pain or no malfunction, so they don't worry about it. In fact, we don't expect kids to experience pain as a result of the scoliosis. It's when the spine is no longer growing and the body is no longer growing that the body can adapt as well to the curvature continuing to progress, and the compression of gravity of the spine to our surrounding tissues is when this scoliosis starts causing pain. So even though no two conditions are exactly the same, we know kids always don't feel pain, but some kids do. And when they feel pain, they typically feel a dull ache at the site of scoliosis. And typically it gets more common as curves become more severe, and they change from mild to moderate to severe, severe to very severe. So the more severe the scoliosis, the more likely it is to cause pain. But there's no number saying that if a child develops a 25 or a 35 or a 45 or 55, they're going to start to experience pain. It's going to be unique to that person. In addition, as the curve becomes bigger, the muscles start to react to the curvature. This is an important concept. Muscles don't cause scoliosis in idiopathic scoliosis. Muscles are reacting to the scoliosis, and this reaction leads to muscle imbalances, which can cause dull, achy pain at the site of the curvature. Now, sometimes kids with no scoliosis have dull, achy pain in their spine just from use or from sports or from activities or from sitting. So we don't know if this could be just a normal activity response and they're having an activity response and it's asymmetrical, so they're feeling dull, achy pain, or it's truly a result of their scoliosis. But we don't expect a lot of kids. They say it's like 5 to 10% of kids that have any type of dull, achy pain. And this could be related to muscle pain or soreness as a result of where the scoliosis is. However, in the adult patient, this type of pain can be very different because it's compressing and it can cause more severe pain. Also, in the adolescent form, as these curves become bigger, we know it can cause this reaction in muscles for them to become stronger and some become weaker. But again, this is a reaction to the curve. So what can we do to help patients that are experiencing back pain? So we know back pains tend to get worse as curves progress, and they tend to get worse as they move into the adult progression. But even in adolescent progression, they're more likely to develop pain. So anything that's working on proactively preventing progression will more likely decrease the likelihood of experiencing pain as a result of your scoliosis. Now, not only does back pain increase with progression, but the spine becomes rigid. And so progression of scoliosis, the spine becomes more rigid and more stiff because as curves become bigger, they become more structural. And this can also affect the results associated with treatment. So this is another reason why we recommend that anything they can do to prevent progression is more likely to produce a better result. Now, corrective conservative treatment plans normally try to combine many condition-specific therapies to produce a result in the scoliosis. Now, what I mean by condition-specific therapies is that if there are such things as general physical therapy, general chiropractic care, general exercise, general rehabilitation. Now, most of these things are done for patients that have an injury and they're trying to recover them from an injury. However, condition-specific, meaning scoliosis-specific therapy, chiropractic, rehabilitation, home exercises are structurally based to try to develop a reduction in the scoliosis to stop progression and have long-term sustainable scoliosis reduction is the best way to prevent pain from occurring. And if you're experiencing pain, it's the best way to resolve it because you're dealing with what's actively causing the problem. Most patients that experience pain as a result of their scoliosis do general therapy or may get pain management, and they have minimal results because none of these are addressing the spine on a structural level. So we know scoliosis back pain is more common in adults where the progression has become compressive. But even in adult patients, as this becomes compressive, it's not really related to the size of their curve. It's related to how much they progress. And this is one of the unique things about adult progression. I can have adults that might come to my office with 25-degree curves and have severe pain, even though the curve is considered mild. Meaning mild curvatures could have severe pains in the adult because they're compressing, and as they compress, they cause pain. However, I can have an adult in my office come with a 60-degree curve that stopped growing at 60 degrees and held it at 60 degrees their entire life and have no pain at all because the curve never compressed. So it's the amount the curve progresses in the adult stage is related to how much pain an adult will feel. Now, even though adults are more likely to feel pain, we know adolescents can feel them as curves get bigger. So the best way to stop pain or deal with pain in the adult form and the adolescent form is to proactively treat the scoliosis as close to the diagnosis as possible to stop the progressive nature of scoliosis, which is what tends to lead to more pain and more effects. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.